Services, and I want to introduce the mayor by saying that on behalf of the council, we wish your wife, Dawn, a speedy recovery.
Thank you. Can y'all hear me okay?
Yes. Go ahead.
Thank you very much. And let me just say thanks to Penny Cottle, too. We've been working closely. She's a professional, and her group, her team, and herself have been so committed and working so hard on this, and we appreciate their expertise and their dedication every day in this. She's been running hard for a long time. We really appreciate that. I'm pleased to be with you again. Nice to see you virtually. You've heard me say we're in a marathon that starts with a sprint. I think maybe I would say we're kind of coming to the end of a sprint and ready to settle into a marathon about now. As you heard from Ms. Cottle, the physical distancing, I call it physical distancing because we don't have to be socially distant. We just need to be physically distant. But that physical distancing is so important, staying at home, except for essential work and activities that you heard her talk about, is so important. We know it's hard. As your mayor, I know it's changed virtually everyone in our city. I know that every city employee, without exception, is doing their job differently from how they did it 2 months ago. Every city employee. There is no city employee that is working the same way today that they did 2 months ago. And that's true for everybody in our community. Everybody's life is different today than it was 2 months ago. It's important to just kind of say, look, if you're out there and you're lonely, if you're feeling isolated, if you're feeling down, we understand that. This is a challenging time. We want to make sure you reach out to people and to each other. If you're worried, if you're bored, if you feel stuck in your home or isolated, please don't be socially distant. Be connected with people. Stay physically distant with people, affirming that over and over and over again. But this is a tough time, and we are, I think, settling into a marathon where we're going to be in this different place for some time, and we need to take care of each other. I do want to, again, thank our workforce, our healthcare workers, the service sector that's working so hard to help everybody else continue to get groceries and pharmaceuticals and other necessary items, and of course, our government employees who are hard at it every day, and we so appreciate that. The surge, we don't know exactly the surge, but it's probably still coming in terms of the healthcare system. But as Ms. Cottle said, the work that we've all done together has really helped protect the healthcare system. So I will just briefly comment. Thank you so much for your comments about Dawn. She's 5 days in the hospital. I'll report. You all know we let that out she went in Saturday. She's 14 days into her symptoms. It's a nasty, brutal infection. It's tough, and she's working hard with great support from people in the IU health system, and we really appreciate the support that she gets, like everyone else in the hospital and in the system. And there's no stigma to having this disease. This is a disease that you get, and you need to get it taken care of. And thank goodness we have the kind of healthcare system and access to it that we do. And I know she appreciates your support, and we'll keep people informed about that as appropriate. And if she's watching, hello. It is hard not to get to.
Hi, Dawn.
Not to get to be in the room with her. That's really tough. But let me just mention a few things, and then I'm going to hand it over to Alex and Beverly to update on the work groups. The Continuity of City Government team is active. They are actually kind of moving into a weekly rhythm now. They began at three meetings a week, really doing the sprint, trying to make sure we adjusted all we could and responded all we could. They're now settling into a weekly meeting to assure that we're keeping on top of this, can give you reports like our firefighter that was our first COVID positive is back at work. That's terrific. Also, all of the individuals who were connected with that firefighter in any way have been either 14 days with no symptoms or they've been tested. We've had a couple tested negative. So it appears that that incident did not expand. At least it looks like that right now. Our second employee from Parks is recovering. I'm glad we haven't had a third report yet, but we'll keep monitoring all that. Masks have all been delivered. You heard Ms. Cottle reference that. The Allison Jukebox has become kind of a mask factory of the volunteer work, quilters and others who are doing incredible things. I think from what I understand from Jason Moore, they've increased production from about 200 a day to almost 900 masks a day from this volunteer army, which is fantastic. We've delivered masks to all city staff. Additional employee changes are underway. We've added 40 new employees to get email accounts that they didn't have before, so they can be better informed in these days of distancing. We have moved a holiday. Steve, I didn't hear the very beginning. I don't know if you mentioned that, but we, because the governor moved the election day from May 5th to June 2nd, the city is shifting our election day holiday from May 5th to June 2nd, consistent with the state's emergency order. And we also have decided, for a variety of reasons, partly because of that holiday movement, partly, frankly, just because our employees are kicking it in and killing it and working so hard, we just decided to add another 8-hour day benefit time to every employee that they can use May 5th if they want, or any time after that this year. We just awarded an extra day of holiday to thank them for all that they're doing. I can report on the Families First Coronavirus Relief Act, which we've mentioned here before. We have had up to date 48 employees seek coverage for that, which is either a 2-week paid leave or a 12-week, 2/3 paid leave for childcare, split mostly on the 2-week, though a substantial number on the 12-week as well. So that's 7% of our workforce, and they're not all eligible to all of that, who have sought that, and we appreciate the chance to offer that, and people are taking advantage of that over the next couple weeks and few weeks. We're continuing our city work from public safety to sanitation to construction projects. You've seen, I'm sure, the list of construction projects that are underway. Farmers Market is underway. I understand that they're tailoring that, learning as we go. I understand they're going to be back up to a goal of about 475 attendees for this coming week. So back substantial growth from this past week. And I am really pleased to let you know that in the midst of all this, tomorrow, there will be a virtual ribbon cutting of the Switchyard Park Affordable Apartments, Switchyard Park Apartments, 8 new apartments that you may have seen there going up. We donated the land, and working with SciHo and others with financial support. Those are 8 new affordable units that will be virtually ribbon cut tomorrow. So look forward to that. I'm so proud of what people are doing. I appreciate all your support. I am also just need to personally thank my staff who have made it possible for me to keep my focus in many ways on my family as I need to, even from a distance, while continuing to try to do what I can and should as mayor during this time. And hopefully that'll all shift for our own family pretty soon, we hope. But I want to thank them individually, not individually. I want to thank each of them for their dedication. They're working so hard. So I'm not going to summarize, but you'll hear from, let's do Beverly, Callender, Anderson first, and then Alex on the 2 work groups. I'm so pleased with what they're doing to help support our social safety net, very important housing progress, childcare progress, others, and as well, I know you'll hear from Alex, the incredible speed and work on the economic recovery work that we're doing. So I'll maybe we let them speak, and then we can all take questions at the end if that works for you. But thank you so much for giving me the time. Thank you. So Beverly, I think you're up.
Yep. Thank you, Mayor. Thank you, Councilmember Volan. So I have been working with these social services working group. And I think last week when I reported, we had spoken to a number of childcare providers and shelter providers and started to assemble their priorities. Some of those have moved forward, those things that we can resource and sort of get some solutions to quickly. We're trying to do that. We have since talked to food providers and persons who are working in areas where health and safety are important. And so looking at mental health issues, things that would cause a public health issues in the community, and other behavioral health kind of things. So that's what we've done that, had a group of about 30 people on a call today. And so that was really interesting. And there were some really emerging themes around that. I want to talk a little bit more, though, about the isolation shelter. If you saw the paper yesterday, you know that the Travel Lodge has been identified and secured as an isolation shelter for people who are experiencing homelessness, who are COVID-19 positive, presumed positive, awaiting testing, or have been required to maintain isolation but have no other place to do it. And so we have been working really closely with New Hope, Wheeler, Shalom, the county, BPD, and the state, pulling that together. The city agreed to be the fiscal agent for that shelter. There is a grant for running that. So we'll be the fiscal agent for that. Unfortunately, they had their first guest last night. It was a gentleman who was presumed positive awaiting testing. His test did come back negative. And so he was leaving today, I believe, either today or tomorrow. But they isolated him while he was awaiting testing. Now that his test has come back negative, he'll be returning to shelter. The state has been really great with us. They have offered support in the areas of putting together security teams and emergency plans. And so the police department and the fire department both have been working closely with us on that. It's really been a good relationship so far. I said to the group the other day, it's going to be really great, and I hope we never have to use it. But, we have had to use it once, and if that's all we have to do, that would be a good thing. Our team has also, or my CFRD team, has been working with the Fabric Mask Project, and I just wanted to piggyback on what the mayor and Penny said, and they have distributed over 6,000 masks in the community so far, and so that really proud of that. And they're still going. They're really going to try to get as many out as we can. We gave some to our DROs and other police officers. So if they are seeing people out and about, whether they're in parks or walking along the street and they don't have them, if they want to have them, they can distribute it to them as well. So those are some of the things that we've been working on. And I guess I can take questions after Alex or.
Yes, please. Thank you. Mr. Crowley.
Thanks, Beverly. So Alex Crowley, Director of Economic Sustainable Development.
Turn it up a little bit, Alex. A little bit.
Hear me okay? Is that okay?
It's a little bit louder.
Okay. Let me see what I can do here.
It's a fancy setup you have there.
It is a fancy setup. How's that?
That's better.
Okay.
There you go. Thank you.
I'm going to share my screen
Yes.
here. I need Stephen's help to share my screen, if you would. Okay.
Stephen, if you would.
Everybody see that okay?
Mm-hmm.
Yes.
Great.
Yes.
So I'm going to give you a quick update on the Rapid Response Fund, and just want to kind of fly through this quickly, and then we can open it up to questions. I will share this document at the end with you, and certainly feel free to ask questions because I'll go pretty fast. So the first thing I want to remind you is we've got a really great team working on this. This is the Economic Stabilization and Recovery Working Group. And just to remind you who's on that, they've been doing unbelievable amounts of work. And it's really very impressive to see this team move as fast as they have. So this is the team. So the next thing I want to talk to you about is we've gotten a whole bunch of applications, and I'll give you some data on that. But I just want to remind you of what the application review process is. So an application comes in. It is scored first as a financial review score by a subset of reviewers that are lenders, and they are going through that application. Concurrently, it's also being scored for impact review. And by that, we mean that the organization, whether it's a nonprofit or for-profit, is being looked at in terms of its impact in the community. So both of those are happening in parallel process. And because the second one, the impact review, is much more subjective than the financial review, which is much more objective based on the information that's being submitted on the application, we have up to five reviewers looking at each application coming across. Both of those yield a score. All of that is compiled, and then it is issued to the city as part of a recommendation sheet. So the compilation is brought together. The city ultimately makes the final recommendation and final decision. And then if it is an approved loan, it is sent through an internal process at the city, which has various different controls. And if it is rejected, then we will issue a rejection notification, which will then trigger an appeals process. And frankly, we are working through the appeal process right now to understand exactly what that'll look like. But essentially, that's how this all works. In the approval process, there is ultimately a loan agreement and other documentation, and we're building that up and getting ready to issue some of that shortly. In the case that anybody has an issue, if you look at the bottom with the application itself, there are essentially two different layers of help desk. One is more of a technical help desk, which is being manned by the city and also by CDFI Friendly Bloomington. And to remind you, CDFI Friendly Bloomington helped build the platform. So they have a good sense. Brian Payne has a good sense of how it works, but also at the city, we can help answer questions. And then if there's more of a general question about how to fill it out, then we send those over to the SBDC and they can help with that. So in terms of application volume, what you'll see is in this graph is the volumes from April 10th, which is the first 24-hour period. And we tend to track these from 9:30 in the morning, at 9:30 in the morning. So these are all 9:30 in the morning numbers. So within the first 24 hours, we had 66 applications that were started, which is the light blue. We had 5 that had been completed, which is the dark blue. And then you'll see in the last date, you'll see an orange in review, which means that's what's being looked at by those two review committees. So you'll see here the trend. There were a lot of, there's a pretty aggressive increase in the number of applications that were started. That increase also played out in terms of those that were completed, but frankly, we're looking at a completion rate starting to tail off a little bit, and we're trying to figure out what's going on with that, and I can talk about that a little later. So from April 10th through April 15th, you'll see that growth from 66 to 138 totally started. 36 were completed as of this morning, and 32 are in progress in terms of the review progress right now. This is a quick overview of nonprofit versus for-profit applicants. So you'll see that the nonprofit, which is in red, is about 22% of the total, and the for-profit is about 78% of the total. We're looking at ethnicity of the applicant, and you'll see here heavily skewed to white applicants, 1 African-American applicant, 2 Asian and or Pacific Islander, and then 3 Hispanic or other. And the reason those 2 are grouped together is because there was a little bit of funkiness, which we'll clear out of the process, where exactly designating that was less than clear. So I've grouped those together. In terms of the gender of the applicants, this is again, all of them being, these are the 32 that are currently being reviewed, as was the last slide. 17 of them are by male applicants, 11 are by female, and 4 other. And by other, you'll see at the bottom, so we have genderqueer and binary at 2 of those. 1 of them had preferred not to answer, and 1 had just been left blank. So the issues and the next steps that we're tackling right now, other than building the actual process, which is literally happening as we speak, and for generation of loan agreements. But the general process challenges that we're seeing is, why is there a drop-off between in progress and submitted applications? Does it have to do with the complexity of the application process? Is there something else going on? We need to get underneath that, and we intend to do that in the next days. Number two, what improvements can be made to the applications and to the review process? So one of the things we're doing is we're having an 8 a.m. Session tomorrow morning with all of the reviewers that can make it to give us feedback about the review process, and anything that we can change and improve on that, we'll implement as quickly as possible to address future applications. The next point is, how do we reach more underserved businesses via communications? And so we're going to dig into that and try to figure that out and address that as quickly as possible. And then also, generally, we're starting to see we're getting anecdotal feedback about the CARES Act, elements of that hitting. And so we want to make sure we understand how this loan fund is fitting in with the CARES Act needs. Next steps. So we're going to complete the review of the first 32 applications and then issue loans as approved. That should happen here in the next 24 hours. And then iron out any process challenges that we've uncovered as either part of the application process or the reviewing process. And then, not unimportantly, because while we're all focused very much on this rapid response fund loan, we also want to start to pivot our attention to mid-range and longer-range planning, which has already started, but we've been so in the weeds on this that we need to do that in earnest. So I'm going to stop sharing my screen here, and that's it.
I want to thank the officers for their presentations. Are there